Hey guys, it's Leah with RetireWise, and I'm here talking with Sean and Todd today. We're going to be going over healthcare and retirement. So we'll just go ahead and dive right in to our first question, which is, why is it important to account for long-term care in retirement?
Yeah, so long-term care is super important. Healthcare in general is super important in retirement, but let's focus on long-term care for a second. 70% of Americans are going to need some form of long-term care in retirement. It doesn't necessarily mean nursing home. It could mean nursing home, assisted living, in-home care, some kind of extended care beyond just going to your doctor or whatnot. But the other thing too is that 70% a little skewed because it also could mean you need it for a week or two. Could mean you need it for 10 years, right? It's all over the board. But 70% is a pretty big number. That means you kind of have to account for it, right? And so how do you account for that in a plan? Well, there's multiple ways to account for long-term care. Yeah, there's long-term care policies, but they're very niche-y and they're can get a little expensive. There's a right time to get into them. You definitely want to talk to us or talk to someone about when the right time is to do that, even if it's a fit for you. And nowadays, a lot of times they're not a fit for everybody because it's a very narrow gap when the right time to get those things are. But there's other ways to address them, whether it's planning for it in your plan. You can self-fund these things a little bit because it's a little bit longer-term horizon. You're funding it in your plans. There are investment vehicles that have riders that cover for it. There's things in life insurance that has things you can cover for it. It's just not a one-size-fits-all. And in other words, there's multiple tools and avenues to cover for long-term care. But a lot of people don't factor in long-term care because folks, Medicare doesn't pay for long-term care, okay? And so it's going to catch you off guard. And here in Georgia where we're at, the average cost for a nursing home, just a straight out thing, could be anywhere from $6,000 to $7,000 a month, right? Well, that could eat into your nest egg pretty fast. Now that number could be different in different areas of the country or the level of service that you need, those kind of things. So that's significant. It's something that we got to make sure is at least accounted for. If you don't need it, fantastic, right? You can use it to the rest of your plan or use it for your legacy. But if you don't account for it, we don't want it to sneak up on you and be devastating to your nest egg.
Absolutely, you're right. All right. What are the biggest healthcare expenses retirees should prepare for, and how can they plan ahead?
Yeah, that's another great question. It kind of feeds into how Sean just answered this one. Number one, we need to have a plan. You absolutely need to plan for this to happen. When Sean said 70% of aging Americans end up needing some sort of long-term care, whether that's assisted living, nursing home, whatever that may be, that is a high expense, or can be, based on what your situation is. And like Sean said, in our area, that could run $6,000 to $8,000 a month, and we don't want to be pulling that out of your nest egg. So, to me, it just goes back to Sean's question. You just need to be prepared, have it in a plan. If we don't need it, we don't need it, but let's at least account for it and start accounting for it at an earlier age. Don't wait till the last minute because costs could be, even higher.
Yep, something we definitely don't need to overlook. All right. How does Medicare work, and what additional coverage options should retirees consider to fill in the gaps?
Yeah, so Medicare, we could talk a long time about Medicare. So what I want to do here is just kind of give you an overview summary really quick, right? Because with Medicare, there's multiple parts to it. And you have to file for Medicare Part A when you're 65 years old, right? You can start filing for it 3 months before 65, during the month that you're 65, or 3 months after you turn 65. So there's a window there. You want to make sure you file for it. If you're not working, you want to file for it for sure, because if you don't, you could end up with a permanent or potentially permanent fee or penalty for not filing, right? If you're still working, there's some provisions there where you don't necessarily have to file for all the different components. But Part A of Medicare is what you've been paying into your whole career. When you see that Medicare thing coming off your pay stub, right? That's what Part A is. That's the hospitalization part, right? And that doesn't cover everything. There's, co-insurance, co-pays, those kind of things in there. But that's for the hospitalization, right? Then we're going to skip C here for a second. We're going to go down to Part B, and Part B is the doctor visit. So not hospital, but doctor visits. You're going to go see your primary care. You're going to go see whatever. Again, co-pays and all that kind of stuff exist for there as well. B is the doctor visit, so you kind of really need both there. Then you move on to Part D, and Part D is the prescription pieces, right? And there's different levels for prescriptions. There's different levels, meaning how much they cover, what they don't cover, so the price ranges are going to be different there, right? It's not mandatory, but you want to look at it. If you're a person that is on medications, you're going to want to have that, and choose the one that's appropriate for you. You don't want to overpay a premium for all this coverage when you don't need it, right? So you want to do it just like we do for retirement planning. You want to do an analysis of what your needs are for Medicare, what's the right plans to get into, right? Those are the main components. Now, In addition to the main components, if you want to have more robust coverage, and I highly suggest that you look at supplements, and whether that's the government advantage plan, which really is that part C, which kind of wraps everything together, or there's some private insurance companies that do the supplements as well. It's all covered under Medicare. It's all controlled and put in a wrapper around Medicare. They have to, be an active participant or qualifying participant of it. But those supplements can be really, really powerful, right? They can help pay for copays. They can help pay for the things that regular Medicare does not pay for, right? Or some of the things. And that can really save you some dollars down the road. It's one of those things where it protects you from loss in your nest egg. Healthcare is one of the number one killers of a nest egg. People get caught off guard. The national average is a couple spending $300,000 in retirement on healthcare, right? Wow. So we want to reduce the impact of that, okay? Now, you got to choose the right supplement. Sometimes Advantage Plan is right for people. Sometimes the private insurance is right for somebody. It really is your preference and what you need. So let's talk through it and figure out what the right one is for you, because it can be devastating to your nest egg if you don't have all this stuff covered. I mean, if you're talking about $300,000, I mean that eats up your nest egg here.
Big number.
Yeah, it's a huge number. It eats up pretty quick. Now let's be clear though that Medicare, even those supplements, they don't cover absolutely everything, right? There's still things that some of these plans don't cover, like dental and vision, and there are pieces that will. Not all of them, so you got to look at what they are, right? And it doesn't cover long-term care at all, which we just talked about.
Yeah, absolutely. All right, thank you for that. Was super helpful.
Yeah.
All right, kind of touching base on long-term care again. How can someone determine whether they need long-term care insurance, and what factors affect the cost and coverage?
Well, that's another great question. It kind of plays along with what Sean was talking about and what we've been talking about the whole time. I mean, I feel like everyone needs to account for long-term care. When you have 70% of aging Americans that need some type of long-term care, I mean, we need to at least have it in the plan. Like you said earlier, Sean, whether we use it or not, we need to at least account for it. We don't look for any surprises, so we need to account for it. And we need to account for it at an earlier age. A lot of things are priced and dictated based off your age and when you do stuff. So if we start at an earlier age accounting for it, it's going to be a little more less expensive generally. And then you could self-fund it. I don't really recommend that. You need to talk to someone about that when you can use it as an insurance play. But I feel like everybody needs to account for it, and it needs to be part of the plan.
Absolutely.
And there's so many different parts of that. I mean, because it's a broad topic. Right, because long-term care can mean a lot of different things, right? And people right off the bat think about nursing homes, right? But it could be more than that. I mean, or less than that, really. It could be the assisted living. It could be the in-home care. It could be just you have a condition that requires more personalized attention on an ongoing basis, right? That long-term care, and there's things that you can do, right? There's multiple tools that we talked about, right? There's multiple tools of how to solve that problem. Right, and it's just like Todd said, as long as we account for it, and let's figure out what the right way is for that person, because what's right for you might not be right for me. Right. But it's one of those most overlooked things, because whether it's someone coming to your house or you're going somewhere, it just adds up really quick. The expenses on that just add up, and you don't want to. And you got to factor in too. If you're married, are we accounting for both spouses, or are we accounting, for one of the? There's just a lot of little nuances that we want to factor into your plan for that.
It seems to be one of those things that are overlooked because they don't need it right now. So
exactly
they
right.
think I'll just wait till later to start.
It's outside of the
exactly.
kind of thing, right? People say, well, I'm not going to need that.
Yeah.
Well, I'd rather you be ready for it than get caught off guard and it just really, hurt your overall retirement.
Absolutely. All right, that leads us into our last question, kind of wrap up everything we talked about, which is how can individuals incorporate projected health care and long-term care costs into their overall retirement planning strategy?
Yeah, so we break this up. We talk about planning in the different categories. We talk about the needs, wants, and wishes, all these different categories of saving up for retirement. It's just not this one big number. Your big number for retirement is broken up into different sections. So we don't know what the total cost is going to be, but we try to estimate, we try to carve out sections, for different aspects of healthcare. Well, we try to get to know you a little bit as well, and obviously you know yourself when you're factoring in healthcare. If you already have medical issues or concerns or something runs in your family, we maybe put a little more weight on that category, right? And again, like Todd said, if you don't need it, great. We'll use it for something else or leave it for legacy. But it needs to be thought about up front. And start looking at your family history, start looking at your personal, conditions and where you're at today. And we just start carving out sections of that for your plan. And here's the thing: we talk about different sections. One of those sections is longer term, right? And we may be a little more not aggressive, but we invest in a way that's still growing things to save for that healthcare down the road. Because one question I get asked a lot is, okay, you say the average couple spends $300,000 in retirement for healthcare. That's a national average. Some are more, some less. Right. Well, say someone comes to me and says, "Well, I only got 600,000 total." You're saying half of my. How's that going to work? How am I going to live off of that other half? Well, it's not. You're not spending it all at one time, and you're not spending it all in day one. Right.
That's a good point.
So it's building it into the plan to continue to account for it and grow different sections and just segment it out the right way. Right.
Yeah.
And maybe throw a few other little tools in there so it's not all just out of pocket. Right.
Yeah. Absolutely.
Yeah.
That's a good point.
Yeah, absolutely. Well, thank you guys so much for all that helpful information. That is all we had talking about healthcare and retirement. So you guys be sure to tune in next time for more information on how to retire wise.